Welcome to Navicent Knows Health. I'm Cindy Busby, and I'm here today with Dr. Joey Slappey. He's a board-certified orthopedic surgeon here in Central Georgia, and today we're going to talk about his practice and his patients. Dr. Slappey, thanks so much for being with me.
Thank you, Cindy. Glad to be here.
Would you first start out by telling our patients how your joints age and what kind of things that can cause in patients in terms of pain, immobility? What are you seeing in your patient population as people age?
Well, that's certainly a very common complaint that people have as they age, and to be honest with you, younger people sometimes too. Our society has, gotten where a lot of people are exercising, they're running, and if you do that to excess, of course, you can have some damage in your joints, which may worsen as you get older too. So there's several reasons for joints to start becoming symptomatic, and as you get older, that tends to be more of a problem, and that's when we see people in the office that have those complaints.
When it comes to doing things like exercising, if we start off with your prevention and wellness side, is there a way that people should be treating exercise so that they don't end up with pain? I'm 50 and by 60 I can really have knee pain if there's something I don't do correctly? Well,
I think that's the key. Doing exercises correctly is the key, and not overdoing it. A lot of us have a tendency to think that if a little bit's good, more is a lot better, and that's not necessarily the case. So exercise is good in general. You need to have a good medical exam from your medical doctor to, in my opinion, to make sure that you're safe doing exercise, and then if you are in moderation, that's a good thing.
Where does arthritis come into play with the degenerating joints? Is that something that you also see when people in their 60s and 70s?
Yes, and arthritis is inflammation of a joint, and we see that as the joint begins to wear as you get older. The natural history in some people is for that to become symptomatic, and that's when we see people initially.
When it comes to treating joint pain, you talk a little bit about how you progress through treatment. What is a first visit like if I've gotten to the point where it hurts enough and I think I need to see an orthopedic surgeon?
Well, and that's very common, something that I see every day, and we generally take a baseline x-ray and do a baseline exam, and then talk about things such as your activities, what you may or may not be doing correctly, what you might be doing that is aggravating the problem. And then as far as treatment goes, sometimes over-the-counter anti-inflammatory medications may be indicated. Icing down after activities, stretching out, warming up before activities, all can help. In some patients, weight loss is something that they need to pursue to get some pressure off their joints. We know that every pound you lose takes about 4 pounds of pressure off of each knee, for instance. So that can make a profound effect in some patients. And then you have other, it's kind of a up the ladder treatment in my practice. Steroids are used a good bit, both orally and intra-articularly, and then physical therapy is also used, and then kind of the end of the road treatment is surgical and would involve joint replacement.
So when a patient has seen you and they've gone through medication, therapy, maybe some rehab, and they get to the point of surgery, let's take the hip for example. What are they looking at in terms of having the procedure and then the recovery?
Well, if a patient gets to that point, we've exhausted conservative treatment, and the patient's physically and emotionally ready, to tackle surgery. We talk about the specifics of the surgery, what that involves. At that point, we get a formal medical clearance for surgery in the majority of patients. So everybody's on board, so to speak, going into the operation. And then I talk to them about the therapy and the time that's required post-operatively to recover and to get back on their feet safely.
Is it important in joint surgery, you talk about having everybody on board, to have a caregiver who's going to be on board with you in order to support you through either knee or hip replacement?
Absolutely. Very important. As a matter of fact, in the last couple of years, we have started doing more and more joint replacements on an outpatient basis. Earlier this morning, I did a total knee outpatient. And so that patient has a support system at home to help her, especially through the first week to 2 weeks, with daily activities and things like that. So that's really important.
When we talk about patients who are facing joint replacement, either hip or knee, how has COVID affected the way patients access care with you?
Well, I think it's made patients much more hesitant to come in and to be seen, especially if they can, quote, put up with it for a while longer. No doubt we're seeing that. We have done some telemedicine visits, especially back in the springtime. And you know, it's hard to examine a joint on the computer, but you can at least observe a patient walk and talk to them about what they're going through and things they might do to try to help. But when patients, my experience is when patients are coming in currently, they're ready for something to happen, you know, because they're kind of at the end of the rope and, you know, they're ready for a procedure.
When it comes to coming to Ortho Georgia for treatment, what are some of the safety precautions that you all have put in place to you know, slow the transmission of COVID-19?
Well, it begins when the patient calls for an appointment. The appointment personnel are asking a series of questions about possible exposure to COVID-19, and then when the patient comes in for a visit, currently we're not allowing family members to come unless it is someone who needs assistance or they have a cognitive issue. Just trying to cut down on exposure for patient safety and our safety too. And then when the patient physically arrives, we do temperature checks and repeat some questions again.
If there's a patient you know, watching today who's considering surgery, what would you tell them about the best path to getting a consult with you? Where should they start?
Well, technically, unless the insurance requires a referral, we don't require a referral at our office. A patient could simply call and give their name and tell them what their complaint or their problem is, and they would be appointed with an appropriate physician to see that problem.
And what would you tell patients who have been putting off care, particularly if it's painful and something that they really do need to have checked out?
Well, that's a question I get many times a day, and basically, if it's a tolerable problem and it's something that you can safely contend with and safely treat for a while, that's fine. But if you cross that line to where you're a fall risk or you're suffering, then you need to come in. And that's a highly individualized assessment. You know, there are people who, you know, are very stoic, and that's probably not a good thing in this particular situation.
Well, thanks so much for telling me more about your practice.
You're welcome. Thank you.
And thank you for joining us at Navicent Knows Health. If you'd like to know more about Dr. Slappey and his orthopedic practice here in Central Georgia, please visit us at navicenthealth.org.